Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the Complex Trauma Training Center. I'm your host, Emily Ruth, and I'm so glad you've joined us today. Are you a mental health professional looking to deepen your clinical expertise in healing complex trauma? We're thrilled to announce our 2025 NARM therapist trainings designed to provide you with transformative training in the NeuroAffective Relational Model. In 2025, we're offering 3 Level 2 NARM therapist trainings, 2 live online cohorts, and 1 in-person training in Scottsdale, Arizona. Both the in-person Scottsdale training and the spring online cohort begin in January of 2025, and the summer online cohort begins in May of 2025. These NARM therapist trainings consist of 4 weekend modules spread out over the year. Through this advanced clinical training, you'll learn how to confidently and compassionately heal the impact of adverse childhood experiences and CPTSD. You'll gain specialized training in a relationally focused, neurobiologically informed clinical approach that supports the resolution of attachment, developmental, relational, cultural, and intergenerational trauma. And you'll be joining a dynamic community that offers multiple learning opportunities to deepen your professional and personal growth. Enrollment is open to licensed psychotherapists, counselors, social workers, and other licensed mental health professionals, as well as graduate trainees and interns working toward licensure. Visit ComplexTraumaTrainingCenter.com to register for the 2025 NARM therapist training that best fits your schedule. We hope you will join us to learn how NARM can transform your practice. And now for our interview. Rikke Pristed has a Master of Science in Psychology and is a specialist in sexological counseling, authorized through the Norwegian Association for Clinical Sexology. She is also a NARM Master Therapist. Rikke has a private sexological practice and was an assistant professor at the University of Agder in Norway for 10 years, where she taught the sexology training program. Please enjoy this conversation with Rikke Pristed. All right, I am sitting here with Rikke Pristed, and I'm so happy that you are here. Welcome to Transforming Trauma.
Thank you, Emily. Thanks for having me.
Yeah. And as you might know, we ask all of our guests a question that kind of helps inform our conversation. And that is, what is it that you would like listeners to get from our time together today?
Well, I've been thinking a lot about that. And I would like to invite listeners to consider how our sexuality is part of who we are as human beings. Because I have a feeling that a lot of therapists are afraid to go into sexual matters in therapy because they feel unsure of their knowledge or their capacities for that. And they might imagine that they need a completely different skill set for working with sexuality. But it really is just a part of who we are as human beings. So I'd just like, to invite people to maybe be more curious about sexuality in therapy.
Wonderful. So if we could rewind just a little bit, and I'm just going to invite you to tell our listeners a little bit more about you and how you came to this work. And obviously it sounds like you're working with couples and individuals, but tell us how you came to this.
Well, I'm a psychologist and a clinical sexologist, and I've been working with therapy for 25 years. I discovered through working with sexology that a lot of people have trauma that is not shock trauma, not from, for instance, being raped necessarily, but it seemed like it was rooted more deeply. So I was looking for a modality that would allow me to understand that better and to help them better. And of course, I stumbled upon NARM, and it just made so much sense to me. So I was really, really happy with that. But I found that because it's really enriched my work tremendously.
Can you tell us a little bit about what does sexology mean?
Well, sexology is a biopsychosocial model. So we look both at the biology of sexuality and the psychology of sexuality, and also the social factors in sexuality. It's more like a holistic approach to what influences our sexuality and different sexual problems. And problems can be, for instance, erectile dysfunction or premature ejaculation, something that seems really physical or biological. But it could also be lack of desire or difficulties accepting a turn-on pattern, for instance, or in couples, it's a lot of the time different desire. Like one person wants sex more than the other one, or they don't want it at the same time, which is, not very strange, but to such an extent that it creates problems for the couple. So it can also be, for instance, if you have 3 children under 5, sexuality probably is very far down on the list of priorities. Sleep probably was on top of that list. But then if you have a partner for whom sexuality is still very important, it can create difficulties in the relationship.
Yeah. And I'm already in my mind thinking of all the ways that NARM has probably informed these pieces that you're talking about.
Yeah.
So can you tell us a little bit about how you found NARM? Because you said that really seemed to align with things that you were already working with.
Yeah. It seemed coincidental, but at the same time, it was just like over a few months, I kept running into people who were talking about NARM, who were already enrolled in the training, and I started reading about it, and I just thought this is something that I want to do. And of course, I started out thinking, and I remember, we have to fill out these questions when we enroll, like, what are you hoping to get from this? And I, of course, wrote, I hope to be able to help my clients much better than I can today. And little did I know that this was just as much about me. So I was completely unprepared for my own role in all of this and my own complex trauma. But I'm so grateful that this is a part of the training, and I've really had a chance to become familiar with a lot of my own complex trauma.
Yeah, which really leads nicely into kind of another curiosity I had, which is, how you see complex trauma showing up when you're working with clients around sexuality, and especially with couples too. Like, how does that, because you mentioned it doesn't have to be a shock trauma. You don't have to be sexually assaulted or have a rape or something for the complex trauma to be affecting a couple's sexual relationship. So can you talk a little bit more about that?
It's something that I'm really passionate about. I was before NARM, and I think I am even more so now, because I've become aware that a lot of traumatizing is going on in ordinary couples. Not necessarily intentionally, although sometimes it is, but most often it's just a question of people not acknowledging their own or things they don't want or things they do want, and they don't either feel it or communicate it, or the other person doesn't hear it. So there's a lot of transgressions going on in completely ordinary couples that if you ask them, they wouldn't say that there were any transgressions going on. But when you look at it, it's like, a question of somebody having sex many times over many years without wanting to. So they're also like transgressing against themselves, of course.
Right.
Yeah.
Right.
So
I'm just thinking about how, going through the training, I started realizing all the ways that one of my strategies was to not speak up and share boundaries or share what I wanted for myself. And so this idea of, if our strategy is not saying what you want in a sexual way, if you don't allow yourself to really feel what you want for yourself sexually, or you don't share that with a partner, then the sex is going to be like another part of what you created your strategies from. So I'm just holding how that just overlays on everything we learn in NARM, like how relevant that is. And I don't know that, years ago I would have imagined it that way.
Yeah. And as I was learning NARM, I was really thinking a lot about, Brett often says that you can use everything for connection and disconnection. And sex is really important in that regard, because you can have sex in a way that you are connected to yourself and connected to the other person or persons you're having sex with. And you can also have sex in a way that you disconnect from yourself and you disconnect from the other person. So sex can be used as something vital. And I'm really thinking life force here.
Yeah.
And it can also be used as a weapon against yourself or against the other.
Yeah. Wow. So you found the NARM training and you're going through the training, and are you already kind of holding like how does this relate to my work with couples around sexuality? Are you immediately kind of going there? Yeah.
Yeah, I asked Brad a number of
Yeah.
times, how do I do NARM with couples? And he finally said, well, I think it would be a good idea to do individual therapy because, the relationship would benefit from that. So I started splitting up my couples, and it's really working very well. I'm loving it. They're loving it.
Yeah.
And I've even written on my website now that even if you come to me for couples therapy, I will most likely recommend that you do individual therapy.
Yeah.
And in the beginning, people were like, but why? Why is that necessary? Is it because you don't believe we have a chance as a couple? But what I notice, and maybe it's not true for all couples, but it makes sense in a way that when we sit next to the person who is most likely to trigger our strategies and try to relate to ourselves in a new way, that might take a lot longer, and it might not even be possible sometimes. So it's much easier to do that work, to relate to yourself differently, also regarding your relationship and your sexuality when the partner is not there.
Right. And you and I have had a couple conversations about this. So I'll just share something that I think I shared in one of those conversations. But I've kind of stumbled on the same thing in doing NARM with couples. And I've done the exact same thing where I'll see them individually. And then when they're ready, just like you're naming, when they're ready, bringing them together. But one thing I've noticed, and one couple in particular, where it was so clear that they had this kind of dependent child sort of dynamic between the two of them. And what we kind of teased out is like they couldn't have this psychological and sexual autonomy when they're in that kind of dependent child dynamic. And so separating them and working with them individually with NARM and then bringing them back together, it's like something clicked for them. And I just wonder if that's kind of what you're nodding your head. So it sounds like that's also what you're...
Yeah, I was just remembering a couple that I'd been doing. First, I'd been doing a couple sessions with them, and then I split them up. And the individual sessions were going really well. But when I put them back together again, it was just like one or the other was always in their strategy. And we were exploring that a bit because they were, at the point where they were noticing when they were in the strategy.
They were noticing. Okay,
they were noticing. And we were just wondering if maybe their relationship dynamics that they'd built up over many, many years required for at least one of them to be in their strategies for it to work. Yeah. So that's really interesting. And of course, scary for this couple, but they wanted to explore more. What would it look like? What could it look like if we were both, in our adult consciousness together?
Yeah, it sounds, maybe how I'm interpreting this. So tell me if this isn't what you're saying, but I think I'm hearing you say, like, in order for people as individuals to grow in their capacity for intimacy, both physically and emotionally, they have to there's kind of a disentangling process that they have to do individually to be able to come together and be ready for that.
Exactly.
Yeah.
Exactly. And it makes sense. Because the relationship is only part of who we are. And there's a very high risk that when we are in our intimate relationship, our most intimate relationship, that's where we use a lot of our strategy. So it's really, I love seeing how people reconnect with themselves individually and bring that back into the relationship and have a much bigger capacity for arguments that don't need to turn into arguments, but, not agreeing on something, that they can just approach that from a different position because they don't necessarily have to think that this is about me. My partner is in a bad mood and it's because I did something, or that they can be more neutral about it and be more present with whatever is going on in the relationship.
Yeah. I wonder if you could speak to, it seems like there's a lot of models out there that really are informed by or rely on empathy and emotional validation, and which really kind of flies in the face of this piece that we have in NARM of differentiation. like self-agency, right? When there's a model where it really relies on the couples kind of validating each other and kind of this emotional, I don't know about you, but like I said, when I was using those models in the very beginning of my work with couples, like some couples it seemed okay, but there were others that it almost seemed to bring up their strategies even more. Like the more it was like this void that couldn't be filled.
Yeah. What I understand now that was going on that was like a bit unfulfilling for me, or like I felt like this isn't quite right, was that it was disconnecting for people to be forced to be validating. You cannot be validating if you don't feel it. And it just felt off for me somehow. So I was very inspired by David Snarch, who is talking about individuation. And I really liked that part of it. I took a workshop with him already in 2009, so that was a lot of years ago. But I liked it, and he has some of that same quality to it that NARM has, like the matter of factness. We are relating to reality, not to some fairy tale conception of what a relationship should be, and I really like that. And that's one of the things I really appreciate a lot about NARM is neutrality is a bad word, but relating to reality and the capacity to be present with whatever is going on inside you and hopefully inside the other person too, when you're capable of doing that. And what I've also noticed about a lot of my couples is that in the beginning, some of them, when they're in their strategies, feel that the approach could be me, of course, too, but they feel like I don't show them empathy, that I don't do what they're used to therapists doing, like, cuddling. We don't cuddle very much. I feel that I am warm and present and I relate to them, but apparently not in the way that they're used to couples therapists doing. And then after a while, when they've been working with those strategies and they show up differently for themselves, they recognize the intervention as caring, as loving in a way that they didn't before. And it was really interesting what you said exactly about the mandatory empathy or validation.
Yeah.
Because it's not the reality of a lot of couples. And I don't know how much you can benefit from that if it's not genuine.
Yeah. And when I think back on the couples that it's like nothing really intense arose in the sessions, but it didn't feel like there was a whole lot of progress. But then there were some couples where I'm guessing, looking back, I didn't know, a lot about NARM at the time, but like the autonomy patterns when they're feeling like someone's telling them to be empathetic. That's interesting. That doesn't work so well.
No.
And it's one thing to notice a strategy coming up and that's information. But it wasn't useful, I guess, is what I'm saying. It didn't actually create, progress in the work with those couples. So it's interesting, too, to just think about, and maybe that's a question I can ask, too. What do you notice, with the survival patterns? Do you bring that into the couples work, or how do you hold that?
Yeah, I do. I actually tell them about NARM and how I work. And I don't go into every detail about it. I just explain about strategies and how we come to develop our strategies, and they usually instantly recognize this. And a good question that Brad also uses, and I think it's easy for couples to understand, is just when you were growing up, how did you have to be okay? What did you have to do or not do? How would you get appraisal or at least not punishment? And most couples instantly recognize that, and they also usually instantly recognize how that plays out in their current relationship.
Those are such powerful questions. Listeners, take note. Asking them, how did you have to, be in your family system to at least, maybe to get that. What were the words that you used?
To get approval, or at least
to get
not
approval.
Punishment.
Or at least not punishment. Yeah. And then when that's named in the room, you said that they often will acknowledge, oh, yeah, I can see that happening in this relationship.
Yes.
Interesting.
Yeah. And they can see how they often view their partner as one of the other parents. And some of the time they've actually found a partner who's like one of the parents. Something else that I've noticed with some of my couples, and it really so touching, is that they all by themselves, I don't say anything because that's not my business, but they recognize how they have been parents to their children. And I have this one man who's almost 60, I think, and it's so moving because he has really been very honest with his children, talking about what it was like when they were growing up and apologizing for the lack of capacity he had then and the bad relationship he had with themselves and of course also to them. And it's made a difference in the way that his children are with their children. So it's just so moving to see this trickle down for generations.
That's such fulfilling work. It's so moving to see, the generational healing, the trickle down.
And it takes courage to acknowledge that you have not been the parent you wanted to be.
For sure. I wondered if we could go back to, you mentioned Dr. Schnarch, and something I've been curious about, and I haven't even thought about how to word this question, but this piece around sexuality, and there's a difference. I think I've heard Brad talk about there's a difference between using sexuality to just have pleasure, in a physical sense, but there's this other level where sexuality and connection in that deeper intimacy, it can become, and I'm not saying Brad said this is maybe how I interpret it, but it can become almost spiritual, or there's a higher level. And I wonder if you could speak to that a little bit. What do you notice in your practice?
Not only in my practice, but of course, I've been reflecting a lot about sexuality and how I view it. And I mean, for me, actually now, I feel like I'm turning into a frumpy old lady, but I don't really see the point in having sex purely for physical reasons. Because then you can just as easily satisfy yourself if that's what you want. Because if you have sex purely for physical reasons, then you're objectifying the other person and probably yourself too. And why do that? So what I want to advocate is when we have sex with another person or persons, why not be subjectively present and allow them to be subjectively present too? And that is where I think the higher level can arise. Imagine having sex from your 50-50 position, where you are conscious of yourself and of the other, and where you register your own needs and voice them if it's necessary, and listen to the other person as well. And where sexuality is used as a way of connecting, not disconnecting. That's what I think can make sex spiritual in a way.
Yeah. And I think you're naming something. The sexual relationship really illustrates how vital that 50-50 is, because if you think about it, if you're out of 50-50, if you're 100% into your partner's experience and totally have abandoned yourself, and years of that, a chronic relationship like that, where you're not connected to yourself in a sexual way in those experiences, that builds. And when I've worked with clients who have had that kind of dynamic, maybe for 20, 30 years even, it's traumatic when they start realizing how they've abandoned themselves in those moments. And that's really profound. It can be really damaging in the relationship with the partner and also damaging in the relationship with self.
Yeah, I totally agree. And that's what I see a lot of. And it is really a deep, deep trauma. Both relational in the sense that it's your relation to yourself, but it's also your relationship to other people. And I just feel like saying that research that made by Justin Lee Miller, I don't know if you know him.
No,
he wrote a book called Tell Me What You Want. It's really interesting about sexual fantasies. But in that, he writes that women actually often objectify themselves even when they fantasize. And I think that's a cultural problem, that maybe we as women approach our own sexuality seeing ourselves as objects, because we are objectified a lot when it comes to sexuality. So that makes it really difficult. I can understand that, to show up as a subject, as a whole human being when you're having sex. But I really think that it's worth it to consider what that would look like. What would it look like if I was to show up as myself in this context? And, I think I also told you this, but I love when Brad says that people do therapy like they do everything else. And I was just thinking, well, people do sex like they do everything else, because we do. So if we're completely disconnected from ourselves and our own needs and feelings when we go about our day, how could we possibly expect to be connected to them when we're in bed with someone, or even with ourselves?
Yeah. That's something I've really liked about Dr. Schnarch's work, is he kind of draws some of those lines of like what happens in the bedroom, in those intimate spaces. Those often are so connected to other ways of relating to your partner. And so really getting curious about that and kind of like, into some of the specifics, which I wonder if we could talk a little bit about how you bring that up with couples. I know I just name it right at the beginning. And I say, this is territory, in talking about the sexual relationship that I feel is really important in relationships. And so, I would just like to let you know that's territory that I am more than happy to explore. I'm comfortable with it. And naming that right in the beginning, because what I learned early in working with couples is that if I didn't bring it up, they thought that it was off the table, that it wasn't appropriate to talk about it.
Do you know the Pristed model?
No, I don't. Tell me more.
It's a triangle. The reason why I'm bringing it up is that the first level, the P implicit, is called permission. And that's what you're doing with your client. You're giving them permission.
Yeah.
Yeah. So that's really important. I'm so glad you do that.
Well, tell us more, because it sounds like this has informed maybe how you're weaving in NARM even.
Yeah. Permission is super important, because as you're saying, if we don't mention it, couples think that it's not important. And I've been really surprised many times to hear people who've been in couples therapy and never, ever talk about sex. Not once.
And like you said, like they think it's a totally separate, like they somehow compartmentalize our sexual relationship is over here and our marriage relationship is over here. And they don't see how those correlate or how they're connected at all. It's so fascinating because we know they're so connected.
We do.
And looking back, I at one time also was, thinking in this way of like kind of separating that. But when we understand how deeply connected everything is, we're more likely to bring it up. So you're mentioning in this implicit model, there's permission. What are the other?
The second level is the LI. It's limited information, where you can say, like, for instance, some people with small children experience difficulties in their sexuality. It's like you give non-specific information. They can take it or leave it. If it doesn't apply to them, that's okay. Or, if you have this disease, then it's normal to experience this. So you just give some information. The third level is the SS. It's the specific suggestions that requires, some knowledge, for instance, about if you have pain when you have intercourse, you should look up a doctor or a physiotherapist, and we can work with it like this or something else. And the final level is the therapeutic level. So that's where, you and I work, is when you can really go into even trauma that require something more than just counseling. So that's a implicit model, and it's actually made by an American, I think, Jack Annan. He was a doctor, I think, in Hawaii from 1976, but it was made specifically for working with sexuality, because he noticed that his colleagues were unsure how to approach this. So he made this model to make it easier for them to, you don't have to dive in the deep end from the beginning. You can just start with giving permission, and we can all do that.
Yeah.
Yeah.
Well, and again, that sounds very aligned to it's giving them agency to bring it up and knowing that, okay, this is, my therapist sees this as relevant. This has been bothering me. I'm going to bring this in, and it helps them connect with that, it sounds like. So very aligned. Cool. What else, have you noticed in working with couples with NARM and how that relates to sexuality?
Well, I think I've always noticed that sexuality is something that a lot of people do compartmentalize. So there's a lot of raw material in our sexuality. it's like we play out a lot of things there that is not necessarily visible to us or anyone else in the rest of our lives. So I think it's really, really an important area to dive in, because there might be some raw material there, like original footage. Because like Justin Lee Miller's book, Tell Me What You Want, he says, I can ask you 15 questions and I can tell you exactly what turns you on. So there's a lot of things that it can be age and gender and orientation and political views and stuff like that. But I think that's also strategies to what turns us on. So of course, if we have difficulty trusting other people, it might be nice to be in complete control sexually. So you see that the way that our strategies show up is likely to also show up in what turns us on sexually. But on the other hand, you might also want to play with surrendering sexually to someone else, but in a controlled environment, like topping from the bottom. I don't know if you're familiar with that expression. If you're assigning power over to someone in a relationship sexually, like one is the top, one is the dominant part, and the other one is the submissive part.
Yeah.
And the submissive part is also called the bottom. But what we talk about there is also topping from the bottom, because the one who is submissive actually has all the power. The one who's submissive decides what is going to happen, when it's going to start, when it's going to stop. So even if they're seemingly surrendering sexually, they call all the shots. So it can be an interesting experiment, even if you have trust issues, to top from the bottom, if you want to like experience a bit of surrendering, but without really surrendering, if that makes sense.
Yeah, absolutely. And I like how you worded it. It's like, we're going to play with this dynamic. We're going to get curious about, if you sort of notice yourself needing to be dominant, you need control, because there's some issues around trust. So what would it be like to kind of play with this dynamic in a different way? And I'm curious, how do you bring that in with couples? Do you name something like that and just encourage them?
Oh, well, I don't encourage them to do anything.
Okay. Well, I mean, encourage them to get curious. Is that, how would you do that?
Yes, I do encourage them to get curious. For some people, it's really difficult. If I ask them, what are you most wanting for yourself sexually? This is a really hard question to ask.
The hardest.
Or to answer, because most people haven't really thought about that. Sex, for a lot of people, is just something that happens. So I invite them to be more conscious of what it is that they're wanting for themselves. And I have a feeling that for a lot of people, they try to get the perfect ending sexually. Not necessarily, the happy ending, but they enact through their sexuality a lot without words often. And so the enactment can become really complicated, and it can be very hurtful sometimes, because they're not really fully aware of what it is they're enacting, but they're playing out some part of their strategy, or what is behind the strategy, the thing that's driving the behavior. They play that out in their sexuality. So I invite people to really be more conscious and curious about what it is it that I do sexually, and why do I do it? What is it that I'm hoping to achieve or get from it? And some people might think, okay, but isn't that taking all the magic out of sex? And I really don't think so, because I think that if you have conscious sex, I mean, not just not being in a coma, but,
really
being present. Being present with yourself too. That's mind-blowing. That's mind-blowing sex, or at least the possibility for it.
Yeah, it's so interesting. And again, working with couples, I'm sure you've worked with, I feel like it's typically women, but not always, who are kind of like, oh, I kind of leave my body, actually. I'm sort of over here. I might feel things physically, but I'm not really present. And I've been really, I guess, surprised to learn how common that can be, especially with women, it seems like, at least here in the US and where I'm working, my little bubble. It feels like that's coming up a lot. And I'm glad that they're coming in for support, and that they're talking about it. For many, it's been decades and not even an awareness. I mean, I feel like there's not even awareness sometimes that they do leave their body. It's more of when we're getting curious about and asking these kinds of questions and you bring in this piece of presence and there's kind of an absent look of like, I don't really know what that looks like. What do you mean by presence? And then the more there's exploration, it can be there's kind of a realization, it seems like, of I don't think I'm present. I think I'm kind of over here. I'm not really in my body. And so that's a really interesting piece that you're naming, I think, of, this question of what is it you really want? Because to address that, we really have to be embodied. And that is terrifying.
It is, yeah.
For some.
And what you're naming now, it really just makes me so sad because I experienced the same thing.
Yeah.
And I think it's just so sad that most women have had experiences that traumatize their sexuality. And more than their sexuality, of course, but definitely shows up in regard to their sexuality. Maybe they've been raped or maybe they've just had sex a million times without really wanting to, or in ways that weren't good for them or nice for them or that they liked or that even did anything for them. So it just makes me so sad to think of how many women have just learned to not be present during sex and maybe don't even fantasize about anything for themselves because they just, disconnected from that part of themselves. And as I said before, I think it's really it can be a huge part of our vitality. Mm-hmm. There's a lot of power in there, connection, spirituality. But if we're disconnected from that part of ourselves, it's just so, so sad, I think. And it's not that I'm not advocating for everyone to just go out and have sex, but when they do have sex, if they do have sex, to invite themselves or allow themselves to be present to, even if what they then realize they want is not what they're having. That's the big problem.
Yeah.
Yeah.
Yeah. So realizing that what you want is not what you're having. So even connecting that piece, and I don't know about you, but I feel like for a lot of folks, even just that realization can bring up a lot of grief. Especially if that's what they're not wanting, that's what they're getting. If it's been decades, a lot of grief around, wow, what would my relationship with myself, my own body, my partner, like what would that experience be like if these last 20, 30, 40 years, I was relating to myself in a different way? And I've noticed a lot of grief can come up.
Yeah, me too. Yeah. And it's understandable. And also because, for some, it really creates a dilemma because maybe, they want to be with this other person and they love this other person profoundly, but the sex is not what they want. And, hopefully if the other part is also in therapy and is open to maybe being curious about other ways of relating to each other sexually, then change can happen. But it's just not necessarily so. There's no guarantee that it can be different. And I think that's why a lot of women that I talk to, at least, they've long since shut down that part of themselves, thinking this is a price I have to pay to have the life I want or be with the person that I want to be with. And I just think that's sad. Of course, they can choose that for themselves if they want to. But I think I would want something more for all of us. And the reason why I think it's also sad, and I'm not saying that men don't experience this too, but I think that both you and I experience that a lot of women have difficulties with sexuality and are disconnected from themselves in that regard. And I just think that's sad because that's more than an individual problem. It's a cultural problem. It's not just about the individual's strategies. It's about more than that. It's about the strategies we use as a society.
And as you're talking about that, that piece kind of arises for me again around those deeper levels of connection that can move into kind of a sacred or a more spiritual kind of orientation in those spaces. And I don't know, I'm just thinking about, again, kind of the grief, for so many when they realize that that's been lacking, that's not present in their sexual relationship.
Yeah. And also for men, as you were saying that, I was just thinking about the being present also involves allowing oneself to show up with vulnerability. And that is something that's really difficult for men in our society because, and probably in most societies, I mean, they have learned to not be vulnerable.
That's right.
And especially not around sex. So they're also disconnected a lot of the time from themselves, but in a different way. And they're also objectifying themselves to perform. A lot of men have performative sex, a lot of women too. But, men pressure themselves a lot to perform sexually, to produce an erection, produce an ejaculation, that takes out a lot of the enjoyment for them too.
I appreciate you naming that. Yeah. Yeah.
So it's a rich and very, very complicated field, sexology, but it's so intertwined with everything else that we are as human beings.
Yeah, it's like you said, this is just part of our human experience. We're all sexual beings. Like if this isn't on the table to talk about, then how can we truly connect in these ways? So I wonder if you are there any sort of examples or client examples that, stories that you could share that might help illustrate some of what you're talking about?
Well, yeah, I'm seeing this woman. I'm seeing her husband too, but this woman had been completely disconnected from her sexuality for many years. And she had a lot of transgressions or things done to her, both as a child and growing up and even in her marriage. And sex was just painful. It was not something she wanted. It was something she did for her husband. And when we started exploring what she might want for herself regarding sex, she started to be more curious and more playful about it. And she had orgasms before, but only with her husband. So she felt like that was something he could give her. It was not something she could give herself. As we explored that, she got curious. She bought a vibrator and she gave herself an orgasm. And that is agency from the top shelf, Then she can choose to have sex with her husband and choose to have him give her an orgasm in the sense that you can never give that to someone. But, she was independent also. She could give herself an orgasm. And that just changed everything for her. She felt so empowered and she felt like I have a sexuality that is mine, that is not dependent on my husband's sexuality. This is mine. And she just connected so much to her agency through that. So that was really beautiful to witness.
That brings in something that's really interesting that I've noticed with clients. And first, thank you for sharing that. I don't mean to breeze right past it, but it sort of adjacent to that I've noticed is at times women and maybe how they're socialized as young girls and young women, this idea that their body isn't their own, that their own experience, even their own pleasure is sort of reserved for someone else.
Yeah.
And so I really hear you again, the agency piece, like how she empowered herself to connect with herself in that way. And so I'm just really appreciating how, even just as you're telling that story, how vital the agency is. And when that's absent, that connecting to life force is that's so powerful.
Yeah. And I really do think it's important that we can give ourselves pleasure. I mean, if we totally depend on another person to give or not give us pleasure, I mean, that's a difficult relationship. And it makes it hard to acknowledge what you need because it's out of your hands. You placed it out of your own hands. So it's not that I think, we can all just masturbate and we don't need to be in relationships. But, I think that we should take ownership of our own sexuality.
Well, and I think the one thing I'm hearing you name in that is knowing our own bodies and And knowing, I mean, we're saying this all the way through. This is like a through-line thread of like knowing what you want. What is it you really want in your sexual relationship? And if you don't know, how does one discover that? And kind of posing that question. What is it that you need to discover? If you don't know what it is you want, then what is it that you need to discover that? So that seems like a really key piece.
Yeah. Yeah. And sexuality is somewhere we can at least connect to through all of our senses. Our sight, our smell, our touch and taste. And it's just really, if you're disconnected from your body, sex will be difficult. Yeah. So it's really very different where we start in the process, because as you know, if we're sitting across from someone who's been disconnected from their bodies forever, maybe, we never push them to go down into their body. We start somewhere else. And it can take a long time, but it's definitely possible to relate differently to your sexuality through this NARM work. And it's been such a gift to me as a person, but also as a therapist. And I enjoy every day giving that present to my clients.
Rikke, thank you. Thank you for the work you're doing. Thank you for sharing that with us today, taking the time.
Of course.
And I wonder, is there anything else that feels unsaid or that you'd like to share with our listeners before we point them in the direction of how to find you?
No, I don't think so. I think, it's been a really good, long, rich conversation we had. I appreciate you very much, Emily.
Oh, thank you, Rikke. Well, on that note, then how can folks find you or get in touch with?
Yeah, I'm in Denmark. And I do online sessions, but, you're welcome to write me an email if there's anything you're wondering or if you want to get in touch with me.
Beautiful. Beautiful. Well, Rikke, thank you again. We so appreciate you and grateful that you're in the NARM community and all that you contribute. And let's keep having these conversations. I sure loved sitting across the table from you and getting to in person connect with you. But this was lovely as well, seeing you on the screen.
And I'm so glad to hear that you're giving permission to your clients too, Emily. Yeah.
I'm learning so much, right? We learn so much from our clients. It's really beautiful. Well, thank you.
Thank you.
Thanks so much for joining us for today's episode. To find more information about our guest, check the show notes or visit us at complextraumatrainingcenter.com/transforming trauma. You can also connect with us in other ways. We're on Instagram, Facebook, and YouTube. As a mental health professional, your commitment to healing and growth inspires us. We at the Complex Trauma Training Center are committed to supporting you in your well-being and success. That's why we're honored to invite you to our Space Program 2025, an inner development program of support and self-discovery for therapists on the personal, interpersonal, and transpersonal levels. Running over 6 online sessions in 2025, this interactive experiential learning program is designed to support self-care and self-discovery for therapists, exploring internally, relationally, and transpersonally. CTTC faculty will welcome you into a professional community of therapists that are seeking to create greater effectiveness and resilience in our professional lives. As CTTC faculty Brad Kammer says, the intent is that this program will help us not only become more effective therapists, but also love our work more. Please visit complextraumatrainingcenter.com and secure your spot in the 2025 Space Program. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Elisa Sponseller for our album art, and to Brad Kammer for the creation of this podcast. We look forward to building community and connection with you and changing the world by transforming trauma.